Okay, so welcome everyone to the part four of the Medentors interview series. This time we're going to be covering the hot topics and delving into the world of healthcare. We're going to be talking about medical and dental hot topics. And towards the start, what we're going to do is primarily touch off with many of our overarching themes, which are covered across medicine and dentistry. So this is going to be the different structures of the NHS, the values, the five lenses approach, all the high yield concepts that you need to have known so you can identify what to talk about. Okay, so that's what we're going to begin off with. Then we're going to delve into many of the bigger, more specific hot topics, particularly focusing on the ones that are more current in the current exams that you'll be given. Reason being is because a lot of websites, whoever's drawn on the board, please stop. Who That many universities, as of recently, what they're doing is they're testing you on hot topics that aren't primarily seen as many of you will have seen previously. Reason being for that is because a lot of hot topics you'll see on websites can be a bit outdated, such as, I don't know, previous ones that were more prevalent. However, now there's a different focus towards hot topics that are being seen more of. So hopefully we're going to try to get practice more of that, things like AI, etc. Okay, guys? Cool. That's going to be our main focus. So for today, I'm sure most of you already know us, but I'm Mohammed Mufti. I'm a medical student, and I'm joined with Abdullah, who is also a medical student, and he's also a dental offer holder at the University of Bristol, which is really nice. And he's going to be taking us through the dental hot topics for today. Okay? And we're all going to hopefully get some practice as we go through the webinar. Okay, cool. For those of you guys who are new, just to introduce you to the Medentors community, we are a group of UK medical dental students and doctors and dentists, and we have talks talking about different career options within medicine, dentistry, and healthcare, as well as helping you guys excel in the application process. We work with schools, we work with communities and group chats. On top of that, we have our academy branch, which helps you guys achieve higher grades in your A levels, whether it be biology, chemistry, or even your GCSEs, helping you guys get those grades to get in, which can be a bit competitive at times. Okay, so the plan for today. First thing we're going to do is break down the basics. What are the structures of the hot topics? How to tackle the specific question types? What sort of skills and competencies are most commonly tested? And what are the interviewers often looking for? Then we'll
Mama,
have an overview of many of the different topics that are being tested, especially for medicine and dentistry. We'll begin with the overarching themes and then more specific ones as we get along with. And after that, you guys will get a chance to practice. It's going to be interactive. It's going to be engaging. Please make sure that you guys get involved. And at the end, there'll be a Q&A for you guys to ask your burning questions, as many of you guys do have your interviews coming up soon. And yeah, okay, cool. So before we begin going into the theme of this, what are hot topics and why are they being tested? You see, this links back to one of the previous webinars we had, especially our first one, where we talked about why you're being interviewed. As well as testing your communication skills, they want to see your commitment towards a career. If you're applying for medicine dentistry, which statistically are the two most competitive degrees in the UK to get into, you have to have a good idea of what you're getting into. You have to understand what are the challenges that doctors are facing and dentists are facing. Not only are you going to be expected to know the challenges that are being faced by doctors, you're going to be expected to know the challenges that are faced by patients, the government, the economy, and how it impacts healthcare altogether. Now, the world of medicine, the world of healthcare is particularly linked with the overall economy, which is why it's important for us to have an understanding of how different socioeconomic factors play a role in the changing of hot topics, okay? And the best way to keep up with this is to read up on the news, read up on articles, and really have an idea of what impacts patient demographics. Now, thankfully, at Medentors, we have an interview guide that's available for free for you guys. I've pinned it on the community group chat, so I definitely recommend you guys reading up over that. But that's essentially what we're going to be testing. For medicine, the main hot topics will be your AI, NHS strikes, the workforce crisis, as well as different uses of medication. For dentistry, we're looking at the junior doctor contract. The foundation dentist NHS contract, as well as prevention, the sugar tax, which is new up in the news, and all of these things. A lot of these themes, by the way, are quite controversial. So it's very important for us to stay neutral as we go into this with our answers. Try not to come across as emotionally invested. Instead, try to discover both the pros and cons of both sides of the argument. And that's how you're going to develop the most compelling answers for this topic. Okay, guys? Cool. And as we go into healthcare, we're going to talk about multiple factors, not just the individual factors, but the social factors, the ethical factors, the biological factors, the psychological factors, and how technology all contribute towards these. Okay. And another key thing that Abdullah mentioned to me just before we started this webinar is a lot of our understanding on how to approach hot topics. Many people, when they begin their interview prep, a lot of you guys are looking at these articles like Medic Portal or UKCAT People, which are really good articles to begin with. But you look at them and you see a whole load of hot topics, and you're like, how am I going to learn all of this content? And I visited a school not too long ago, and a lot of students were coming to me saying, I saw all these contacts, and they weren't essentially, um, you know, going into there was too much detail that they were going into. And as a result, what was happening? There was too much for us to know. So then what happened? Then after that, what I told them was, guys, look, you do not need to know this much detail of the hot topics. There's only a specific amount you need to know into. And in our interview guide, we've summarized what you need to know, how much you need to know about, and what sort of things you need to consider in your answers. It's more about how you act within it. Okay. Yeah, Abdullah, could you just remove that message chatting here on the chat? Thank you. Okay, brilliant. Okay, so now that we've got that out of the way, we're going to go into these things. As we've already talked about and discussed why these hot topics are tested, they test your interest within healthcare. Have an understanding of what sort of factors influence what makes an efficient healthcare professional. On top of that, because we're considering the five lenses approach, which we're going to be touching into very, very soon, the five lenses approach allows us to consider not just the aspect of us as healthcare staff and potential medical and dental students, but as well as the patients. We begin to appreciate what sort of challenges they face, such as waiting times, such as prolonged chronic diseases, such as aging population, such as lack of resources, even things like confidentiality being impacted by changes within AI. All of these factors are considered when we look into these things, okay? And on top of that, always reflect on the long and short-term influences. That shows that you are a long-term thinker. And the NHS, they are looking to sustain a long-term workforce, which is going to make you much more suitable for this role. Okay, cool. So how do you discuss a hot topic? Now, this is where the five lenses approach goes in. I always tell my students, whenever you get a hot topic station, always consider these five lenses. If not all five of them, at least three of them. But the main point of a hot topic station is to show that you're considering the overall NHS population, okay? And as a result, you're not just considering yourself as a doctor, but the patients, the healthcare force. So, for example, let's have a look at a specific hot topic. Let's say I pick something such as alternative medicine. Now, does anyone know what alternative medicine is in the chat for you medics? Yeah, brilliant. Herbal alternatives to medicine, remedies. Yeah. So alternative medicine is what a lot of patients who often come from, ethnic backgrounds and minorities, what they often do is that there's prescribed medications that they take, such as herbal remedies. For example, many of you guys probably have all have heard this, and there's actually benefits to it. There are herbal remedies such as, I don't know, ginger tea and lime, as a result, which patients take as a result to help cure a sore throat. Now, obviously, we know that if someone has an oral infection, oftentimes, if it's severe, we give them antibiotics. However, what we also know is that there's other remedies which can help ease the symptoms. Now, many patients, they take this to one extreme and they take a large amount of remedies. So I'm just picking one random hot topic and I'm going to walk you guys through how it impacts all five of the five lenses. Okay, firstly, starting off with the patients. Patients, they are of different backgrounds. So because they're of different backgrounds, there's different socioeconomic backgrounds that have a greater prevalence for taking these remedies. Therefore, it is important for us to communicate with patients at an individual level and let them know why they should take their prescribed medication as well as their alternative medication that they may be taking due to cultural reasons, okay? So in your answer, always include that it's important for us to be empathetic, open, let the patient speak out about how they feel about their alternative medication, why they feel so strongly about it. Then tell them your approach, signpost them to evidence-based resources, make them aware of what sort of support nets are available to them. Give them longer appointment times as well, because a lot of this may be cultural and they may feel offended if you feel that, what they're taking isn't best for them. A lot of patients, by the way, may be taking alternative medicine that they may be allergic to and they wouldn't know, and perhaps it could be worsening their symptoms. So it's important to be able to talk about it to that detail. Now let's talk about the role of professionals. Now, when we talk about alternative medicine to do with professionals, we could talk about is the role of doctors and dentists to be aware of how these things impact the health. For example, if you're taking a oral remedy and let's say it causes gingivitis in the teeth and let's say you're seeing a great amount of patients within your population attending the dental clinic due to this oral gingivitis, what's that going to lead you to feel as a dentist? You're going to feel like this has to be something that's dealt with. So it's important for professionals to collaborate together and outreach about how to prevent this from happening and be well informed themselves. It's a point for them to be educated. Thirdly, the healthcare system. How does it impact the NHS? Perhaps there are many patients who are presenting due to this, like for example, the gingivitis example I gave. Many patients in a certain population are presenting due to taking this remedy to the clinic, which is increasing waiting times. It affects the healthcare system. What about society and public health? As again, I was previously talking about, alternative medicine is more common in those from lower socioeconomic backgrounds. So, for example, maybe public health campaigns could be led towards specific areas. Maybe certain information centers and leaflets and posters can be posted in areas which there is a greater prevalence of use, perhaps. And what about economy and policy? Well, perhaps due to alternative medicine becoming more prevalent, there may be certain companies that are trying to profit off the information that's made available to them. So they could be using schemes such as, marketing and profiting, which is incorrect. And therefore, as a result, what's going to happen? And there may be some policies that the government may use to tackle that, to prevent pharmaceutical companies from essentially, trying to profit from misinformation. As a result, this is how it impacts the economy and policy. Something like that. Essentially, what I'm saying is every single hot topic can be linked to the 5 lenses. Now, you're not supposed to go through all 5 lenses methodically in your answer. Rather, what the recommended approach I'd say to give you guys to do is to consider at least 3 of them. Okay, so consider patients always, the healthcare system, and wider society. All the time, those are the 3 main ones that come up again. It shows that you're thinking holistically, and it's going to set you a band above all other applicants that apply. Okay, cool. Now, how to structure your answer. Now, there's many different ways to do this. The ideal approach is one good way, but the way I like to do this, and it's really that simple. And for those of you guys who've attended our interview course or attended any of our webinars, will know that I'm always talking about that the best way to structure your answers is to do it this way. Firstly, you want to introduce a hot topic, okay? So for example, we were just talking about alternative medicine. For medicine. So what we could say is, as an introduction, alternative medicine are herbal remedies that are used to supplement and treat illnesses. That's my introductory statement. Then you go into the pros and then the cons. Compare the 2 together. Okay? So a definition, pros, cons, and then a conclusion. That's how you want to structure your answer. So a definition I've already given. Pros could be the alternative medicine. A lot of evidence-based research shows that many remedies, such as ginger, lime, they have anti-inflammatory properties. And due to these properties, they actually do help patients improve their symptoms. On top of that, it promotes a healthy lifestyle and therefore can improve the quality of life of many patients, helping reduce the prevalence of chronic diseases. This supports the ethical pillar of beneficence, bringing in your ethical pillars there. So introduction, pros. Then you move on to your cons. So you can talk about things such as many patients may have contraindications, such as they may be allergic to certain remedies without knowing, or perhaps they may be using these remedies as a replacement for the traditional medicine that's prescribed to them, and as a result, their symptoms are actually worsening. This is why it's important for a doctor to be empathetic, approachable, and clearly communicate and make sure the patient is aware about why they're taking their traditional medicine on top of their alternative medicine. On top of that, there may be companies that are trying to profit off marketing schemes and spreading misinformation about traditional medicine, as a result, weakening the patient-doctor relationship. So then you talk about the cons as well. So I've talked about an introduction. I've discussed the pros, the cons. I've brought in my ethical pillars. I've talked about the 5 lenses. I've talked about society. I've talked about how patients are affected and the overall health, as well as the psychosocial factors. Then towards the end, you give your conclusion. So intro, pros, cons, linked to the 5 lenses, conclude. My conclusion will be something like, overall, I can see why alternative medicine is a useful supplement towards helping patients improve their quality of life. However, it's very important for doctors to be well informed and make sure they signpost patients effectively where needed to help them get the best quality of care with both traditional and alternative options. Okay, that's how you would structure an answer, for example. Okay, now moving on to NHS values. Now, a lot of these are linked towards our personal quality station or our motivation station, which many of you guys will have known from the previous webinars. If you haven't already seen them, I would definitely recommend you guys to check them from the chat description in the Google Drive. So these are the main NHS core values. And what these do is underpin really what the NHS stands for. So there's teamwork, respect and dignity, commitment to quality care, a lot of this not only refers to working within a team and being respectful, but as well as that, it also refers to how we treat patients. We always support them with what is needed. And it's important for us to really know these things. So the 6 C's you guys over here, you guys definitely need to know them for both medicine and dentistry, okay? Because they can ask that in an interview. Tell me about the 6 C's, okay? This is one of the things that can be asked. Now, one of the things I talk about for this case is that sometimes core values are breached. And the reason we say that is because in the NHS, there may be lots of systemic issues that are pressuring the workforce. For example, overburdened waiting lists. Many of us know that many hospitals can be understaffed. If hospitals are understaffed, many doctors may be seeing lots of patients. They become burnt out and they may misbehave in front of their colleagues. Now, when this happens, we would follow an approach known as whistleblowing, which is making others aware of issues you're facing within healthcare staff. And that's important for us to do as doctors, dentists, and healthcare professionals because it's important for us to communicate where we feel uncomfortable. In medicine, a lot of the time, there's a hierarchy system that is not often discussed. And we actually had a lecture about this in medical school. So we had a tutorial where we were giving cases of actual hierarchical cases within medicine, where it's sort of like an unwritten rule that the consultant's the boss and whatever he says goes. And for those of you guys who've done work experience may have seen something like this happen. And unfortunately, it is a bit of truth to that. And hopefully this is where whistleblowing is coming into play with things, where it's trying to amend and change this so we can move towards the better improvement and equality for all healthcare staff. That's something we can bring up a bit as well. I'm not going to go into the 6 C's in a lot of detail because a lot of this has been covered in our personal qualities and motivation station webinar, which I definitely recommend you guys to check over. But you can be asked about these, so it's important to know. Okay, now we're going to touch a bit more into the NHS structure. So the NHS operates on a 4-level system. The primary care system is first. Primary care is probably the most important one. And we're going to have slides coming up very soon talking to you about the primary care stretching and its crisis. So this is the first point of contact you have. There's a mistake on the slide. A&E should not be there. A&E is in secondary care. But this is where the patient first sees the healthcare profession. This is their first contact with the healthcare system. So oftentimes what we talk about primary care is someone comes in with a sore throat and they talk about, oh, I have a sore throat and this is my condition. That's the first point of contact. Now, the reason primary care is so widely invested in is because we want to expand the net of healthcare available, not just in certain regions, but those in less advantaged areas to reduce inequality, to improve the accessibility of healthcare so diseases can be spotted earlier. When diseases are spotted earlier, there's a direct relationship, strong positive correlation with the fact that it is treated better and there's a better prognosis. Prognosis meaning outcomes. So outcomes are always better. So this is like your dental clinic. If someone comes in with caries and you spot it at a later level, there's a greater risk that it's going to lead to systemic illnesses, which is why it's very important for dentists, even at their general dental practices, to be performing at a primary care individual level. Okay, cool. This is why a lot of public health policies are surrounding this. The next point of care is secondary care. So this is what happens when we go into more planned in-hospital, inpatient treatment. So now your GP has been like, okay, you know what? Your condition, I can't just give you antibiotics and tell you to go away. It's actually a bit more severe than that. So what I'm going to do now is admit you to hospital. Or you can have a condition, an appointment with this clinician in a couple of weeks' time. Something along those lines. You're in that secondary care loop now. So this is where you get your planned or elective care. So this can even be surgery, by the way. This is where we are going into more specifics. You're being treated by a specific specialist. This is where the majority of hospital doctors and staff work in, and why a lot of staff become specialized. And hopefully this is something you guys will be going into as doctors and dentists. Then comes tertiary care. Now, tertiary care is very sparsely surrounded in the UK. Reason being is there's very few specific tertiary care centers. These are highly specialized for specific specialties that a doctors often, dedicate their whole lives towards achieving. So it's a very small subset that can only be performed at that level. There's a question in the chat. ICU would be secondary care. Tertiary care is where we have specific care, and this is only for the 1% of cases, okay? That's all I'd recommend you guys to know about that. Quaternary care is the last one, and this is the highest level of care. Now, whenever I talk about quaternary care, I talk about what I'd recommend you guys to learn is the quaternary care is your theoretical medicine, meaning that all of the quaternary care that's made available is theoretical. It's not actually proven to work. It's for the most rarest 1 in a million cases that often patients are given treatment for. So many of you guys will have perhaps heard about the Charlie Gard case. You're not expected to know it, but it was a case about this child who had a mitochondrial disease. So there was a disease with his mitochondria, and the treatment would be very expensive. It would be worth millions. But essentially, he had like a very low chance of survival. So his family, no, you're not expected to know cases, by the way, in the chat. Someone asked. But his family tried to raise money because the NHS wasn't, willing to fund it. Because his chances of survival, even if he did get treatment, would be like 2%. So instead, his parents raised some money for his treatment to be done abroad because there was a doctor in America who said that there's a good 5 to 10% chance that he can actually make a recovery with that. So what they said for this case was that they actually did manage to raise the money, but I don't think it got carried out. And even if it did, his chance of survival would be very low. So therefore, the overall cost benefit of this investment would not be optimal. Okay, you're not really expected to know these. I'd mainly focus on primary and secondary care. These are the main ones. Primary care comes up a lot because this is talking about equal access of healthcare. And oftentimes, this is what you'll be expected to know about. Okay, so Abdullah's going to walk us through the junior doctor strikes.
Okay, thank you, Mufti. So, this is something which is really prevalent at the moment, and I'm sure you've seen it everywhere. Junior doctors are striking for increased pay, and the reason behind it is that inflation's gone up more than the pay rise has gone up. You don't have to know too much about the exact details, but just know the brief idea. Now, in the UK government, the laws state that all professions have the right to strike, but for emergency services, it's a lot more difficult. For example, doctors, police, firemen, if they strike, it affects people, and their strikes are a lot less frequent and have a larger effect. Now, that's legally they're allowed. However, it's a balance of non-maleficence and justice. If you have any ideas why it's non-maleficent, put it in the chat quickly. But justice is obvious, right? It's unfair for doctors to be paid less than what they deserve to be paid, right? So if someone does work for these long shifts, night shifts, on calls, whatever it is, but they get paid less than what their worth is unfair. So that's justice. Non-maleficence, okay, someone's DM me. Yeah, exactly. Non-maleficence can harm patients if they don't show up. So if a doctor doesn't show up to work, no one's going to be affected. For example, if you go to A&E, if there's no doctors in A&E, all those patients coming in can't get treated. So the NHS is already understaffed. There's already pressures on the NHS. And having junior doctors, which is the bulk of doctors in the NHS, if they don't show up, it really affects them. So there's a fine line between non-maleficence and justice, and that's what interviews want to hear you say. They want to hear you talk about that balance and how they balance it. So the BMA is the big union in the UK for doctors, and their part of their role, part of their job is to make sure that only the bare minimum of doctors strike compared to how much could strike. Does that make sense? Okay. So impacts, you guys have mentioned them already. Short term is cancellations in for appointments, surgeries, etc. Longer waiting list. So already COVID made a huge backlog, and having doctors not show up to work just makes that even worse. And a lot of the big kind of quaternary care centers, like hospitals around the UK, they have they don't have enough staff to operate at a high level, so they have to cancel loads of surgeries. And it means that the doctors who do show up and work have an increased pressure. So consultants, for example, there are very few consultants in the UK compared to how much there should be. If doctors don't show up, they have to do a larger responsibility, which isn't really fair on them either. And long-term effect, though, is that striking has made an impact. They've already gone up, I think it's 2% in pay rise, and the government is considering going up even more. So it does have an effect, but it's a balance between the short-term effects and the long-term effects. And yeah, like I mentioned, you can learn the background context if you want. So, like Mufti mentioned, UKCAT people, the interview guide, these all have different examples explaining what's going on. BBC Health is a really big one. It has loads of articles about this. The main point, however, is how you would approach this. One big thing which is something people forget is be careful. Most of your interviewers will be doctors, nurses, etc. Don't go in with your guns blazing, have a very strict approach to your answer, because it does mean that they might judge you for it. So if you have a junior doctor in front of you and you say strikes are horrible, they should never happen. Doctors don't deserve to get paid more. They're not going to look at you correctly. So be careful how you talk about it. Be sensitive and just be mature about it. Okay. Next up, we have aging population. Aging population is one of the big issues in the UK specifically, and it's to do with how, due to healthcare advancements, so we've got a lot more treatment, a lot better healthcare. People live for longer, and the life expectancy is going up year on year. But that does mean that you have loads of chronic diseases, comorbidities, polypharmacies, and other issues which show up because of this. For example, as people get older, they're more likely to be sick, and they have more chronic diseases, diabetes, osteoporosis. There's a bunch of diseases. These all build up as they get older, and that means they cost more. Now, the key issues here are resource allocation and ethical reasoning. Resource allocation because the NHS only has so many doctors, so many beds, so much money they can put in. And they'll often give you questions where they actually compare a 95-year-old grandma and a 20-year-old guy, right? It's a big issue. And it's something which doctors really struggle with as well. So that's one of the common questions you'll see come up. And uh, ethical rationing, which comes in with that as well, which is who do you prioritize? I'm sure I've done questions with some of you guys as well, which is where you have, for example, organ transplants with a 85-year-old grandma who's got diabetes, etc., and a 25-year-old mom. So these are some very common questions which come up, and you can't really prepare for them as such, but you can learn the rationale behind it and apply that to each question. Again, the impacts. Short term is longer waiting times. Care homes send so many patients into A&E and GPs behind every day, which makes the waiting list even longer. And care homes often have doctors who leave the GP and travel over there to treat patients, which takes a lot of time. So the waiting list is built up even more, which is already backlogged enough. Staff fatigue. So I'm not sure if you guys know this, but GPs often travel from their GP to care homes, and that takes a lot of time. And it's obviously tiring, driving 20, 30 minutes to go to a care home, come back, etc. So that's another point you can mention. And like I mentioned, lack of beds. There's only so many beds in a hospital. If they get filled up, people have to wait. The long-term benefits and issues are preventative healthcare. That's something that the NHS is doing a lot more, which is public health and preventing people from showing up and ending up in hospital in the first place. Second thing is integrated care. If you can treat people in the community setting firsthand, that's better than people showing up to A&E. Mufti mentioned in the NHS structure, primary healthcare is a lot cheaper to run compared to secondary healthcare. So a GP appointment is a lot cheaper compared to an A&E consultation. So if you can stop people showing up to A&E in the first place or any of the secondary healthcare places, that's better than primary healthcare. And then next is proper management, which is a lot of these things can be streamlined and made a lot more efficient. So if you can research, there's a bunch of topics about this. You can research so many different methods to do this, and it just makes the whole healthcare process a lot more efficient. And last point, or second last point, is autonomy versus justice. Autonomy is, I'm sure you guys all know this, you've learned this already, is an individual's own choice to the right of treatment. But justice is it fair to give these older people who have fewer qualities, like Mufti mentioned in the chat, fewer years left to live, these resources? So it's a big balance, and it's a common issue you'll see in your interviews. Learn this topic because this is a massive topic and it comes up every year, and it's never going to go away. And again, like Mufti mentioned before, understanding the principles is much better than stats. Someone asked in the chat before about learning stats and making stats up. Don't learn that idea. That's more than enough. Stats don't really change your answer massively. Uh,
Yeah, thanks for that, Abdullah. Just to add on, just want to like renounce that quote. Stats do not matter as much as you guys think. It is better for you guys to learn the content. For the example I gave you guys about how to tackle a question about alternative medicine, I didn't really mention any stats. I talked more about the theory and how it impacts the different of the five people in the five lenses. And as a result, it made my answer more compelling. On top of that, one more thing I just want to add on top of the aging population that's really important is, as Abdullah mentioned, a greater proportion of the UK is living longer. So we're getting really good at keeping people alive for longer. However, they're living longer with great more amount of diseases. There's two types of life expectancies that are out there. There's the life expectancy, which is moving up every year. It's going from the 70s to now it's the 80s, the average life expectancy is. However, there's also the healthy life expectancy, which is the number of years a patient lives before developing a chronic condition. The healthy life expectancy in the UK for the past 15 years has been stuck at 55. It's not improving. So we're not improving how long people live without developing a chronic condition, which means we're struggling with things like controlling obesity, controlling smoking, controlling alcohol intake, controlling exercise, which are the factors that are leading people to develop diseases earlier than they should. We should be looking to push that number above 55 to like 60 or something like that. Okay, so talk about healthy life expectancy and life expectancy. I'll put that in the chat for you guys to review.
Perfect. Thank you, Mufti. Okay, next topic is mental health, especially now with post-COVID. This is a really big topic which is going on. So, mental health. Mufti's into the wrong chat. Okay, so first step is priority of esteem. It's a fancy way of saying essentially that mental health and physical health are equal, but they should be equal at least, right? Realistically, they're not treated as equally due to societal stigmas, etc., but they should be equal. I'm sure you've all heard of biopsychosocial model. This ties in over here really nicely. And the reason it's not treated so well is there's a bunch of syndromes you can read about, but mental health often is stigmatized, especially in males or certain ethnicities such as South Asians. And because of that, people don't get the treatment they need early on enough, and things develop and just get worse and worse and worse. So, ideally, in an ideal world, mental health and physical health are treated completely equally. Now, there are reasons this doesn't happen. Number one is money. This is a really common issue in the NHS, but the NHS can't afford therapists or therapists from an earlier point. A lot of these issues develop in childhood and they just get worse and worse and worse over time. So underfunding prevents that from getting better. Again, a really common issue, long wait lists. There are so many people, especially post-COVID, where people went through loads of trauma, loads of stress, and the waiting list for mental health got even longer. And now the NHS is trying to clear that backlog, but it's not a fast enough rate. People are joining the list more and people are leaving the list. Does that make sense? And like I mentioned, staff shortages. Therapists and obviously all the other mental health healthcare professionals who come in, there's not enough of them. And it's not as easy as just importing more doctors, right? There's a lot more things and nuances behind it. So read up on the staff shortages. That's a common topic which comes up in like half the hard topics. It's really, really common. So read up on that. Wait lists as well, right? Wait list is such a common topic. You can get some numbers on that and learn statistics as well. Like we mentioned, it's not important statistics, but it's nice to know. So just read up on those as well. But yeah, underfunding, which is a really, really common issue. The long-term effects are especially on the patient itself. Mental health, right? If you struggle with mental health, you're going to struggle to operate normally in society. That means underemployment, right? It means struggling with your family, social issues, etc. So mental health has a really big impact on people, just as much as physical health as on people. Say with chronic illnesses, a lot of chronic illnesses are exacerbated by mental health, and a lot of illnesses are caused by mental health. And the last point is staff retention. Mental health isn't just for patients only. It's also for the staff and the people who work in the NHS. Imagine you're a doctor in the NHS. You work night shifts consistently, long hours, not enough doctors, so much pressure. You're dealing with such emotional difficulty. It's going to be easy to work there. People leave the NHS because of this, and it's a really common thing. So if you can improve mental health for staff as well, it makes doctors want to stay and want to be here for longer. Loads of doctors will leave the UK and go work in Middle East, Australia, USA because it's easier, right? It's not really easier, it's just the conditions over there are a lot better. That includes finances, but mental health as well. Now, there's also some ethical issues that come with this, right? The big one is postcode lottery. This is a separate hot topic as well, but it links in over here, which is that certain postcodes are treated better because of the fact that they have more resources. For example, someone living in a big city like Birmingham, London, Manchester is going to have better access to, all these treatments like therapists, uh, therapy access, consultations, compared to somebody who lives in like the villages of Peak District, right? So postcode lottery is a really big issue in NHS. They are trying to combat it with telemedicine, but telemedicine isn't going to replace the face-to-face communication that people have. So it's a balance of that. And the second point is prevention versus crisis. Is the fine line between stopping people from showing up to the hospital with these issues versus treating people. I did an interview with someone today about prevention versus treatment. This is a really common issue. So read up on the balance and which one should we prioritize. It's not a simple yes or no answer, but there are pros and cons for both of them. One of the big issues is people believe in the NHS we don't treat them early on enough, and everything just get worse and worse and worse, and then it's too late or it's too expensive to treat someone. And the last point is tackling mental health is not just treating the illness, it's about making mental health such a easy topic to talk about that's sustainable, it's human, and it's natural to mention. This is something I'm sure you've all read or at least heard about, which is how, for example, boys don't really talk about mental health, which is a stereotype, but it's something which the NHS is trying to break down slowly. Or another one, which is, I know that's not mental health, but anyway. So mental health has a bunch of stigmas which surround it, and breaking those down is part of the NHS's job to ensure fairer treatment for everybody. Make sure when you talk about hot topics, you always link in your NHS values, so justice, beneficence, non-beneficence, etc. They all link in. Just make sure you pick the most relevant one and tie it in. Okay. Next up, we've got primary care pressures. So primary care, like Mufti mentioned, is mainly your GPs. That's the big one, right? And also your community service, community stuff. GPs is the big one. GPs, their job is people come in, they either treat them right there and then, or they escalate it and pass it on to a specialist. So, for example, you show up to a GP with stomach pain. The GP might give you antibiotics, send you home. You come back again because it hasn't worked. He'll send you off to a hospital. The GPs are like a lobby. They send you off to different places. Now, the issue is basically everyone will go to the GP. The exception is A&E. Everyone outside of A&E will go to GP. And the demand is going up and up and up, but the number of practices are falling. Reason being, it's very expensive and very unsustainable to run a GP practice, right? There's huge costs, and GP practices they're privately contracted by the NHS. Don't worry about it too much, but it's expensive, simply put. In 2024, 5 million people waited longer than 2 weeks for their appointment. 2 weeks is the ideal GP timeline for a consultation. So when you phone in for an appointment, you should get an appointment within 2 weeks. 5 million people waited longer than this, which is a huge number. And that means people's symptoms will get worse, right? For example, if somebody had a viral, that could be treated really simply. If they have to wait more than 2 weeks, it could develop into something a lot worse. And then has to be escalated to secondary care instead. So it affects patient safety, which is obviously one of the NHS core values. And it often affects NHS outcomes as well. It's cheaper, like I mentioned, to treat someone in the GP compared to treating them in A&E or in a ward. So if you can cut down on the GP wait time, it really helps. How can we do that? So the big one is telemedicine. Telephone appointments are a lot easier compared to sending a doctor over to treat them at their house, right? The easy one is increase the number of GPs, right? It's not as simple as increasing the number of GPs, but that's a big way of working towards it. And one of the other issues is high workload. The average GP last year dealt with more than 2,000 patients in a year. You can work that out, that's a huge number, right? If we can reduce the number of patients each GP has, or make appointments shorter, or work towards it to ease the workload, it really helps GPs. I'm sure you've all done GP work experience, or a lot of you have at least. I'm sure you've seen how short the time frame is. 10 minutes is not a lot of time. But when GPs have this many patients, they have to overrun, right? Okay, telemedicine. Like you mentioned, COVID really helped introduce telemedicine, which is online medicine. That means online appointments through digital platforms. They do help. Like you mentioned, the postcode lottery, it does help over there, but it doesn't replace it. So make sure you balance both of those things as well. And like you mentioned, primary care strains, so GP strains, will cause larger pressures on other places instead. If GPs back up, A&Es back up. If GPs back up, hospitals back up, etc. So a lot of people will often skip the GP and go straight to A&E when they don't need it. It all adds up to the pressure. So GPs are a huge help towards this. There's a slide on here about, or the picture on the BMA, which have an article about the GP contract changes. Read up on that. Read up on GPs as a whole, because GPs are really, really important. Okay, next up, we've got public health. Sorry, we was going a bit slow. We'll try and speed it up. Okay, public health. Public health is treatment for the wider public as a whole. That means treating people without even them showing up to the hospitals. That's treating people like me and you to start at home. This really helps reduce the burden on the NHS. For example, obesity, smoking, all these things which are caused by risk factors, right? Smoking is caused by smoking cigarettes. That causes COPD, lung cancer, etc. If we can stop people from smoking, it reduces the number of people who show up to hospital with these issues. And it's really easy to do. I'm not sure if you guys have seen, there's a bunch of public health campaigns like the NHS in Manchester, they said to get off a stop early and walk to your next stop. So prevention really helps to reduce NHS burden. You can search them up. There's loads of them, loads of ideas. And improving the population health generally makes the population fitter. Mufti mentioned a lot earlier in aging population how the average life, something about it being 51. I can't remember what he said exactly. But if you can stop people from having these issues, comorbidities, etc., you can treat them earlier on and prevent them from showing up to hospitals in the first place. Does that make sense? And like we said, these preventative measures are cheaper than doing a surgery or something for that, right? Uh, I'm not going to go through examples, someone's message, for example, so I'm not going to go through them. There's a lot online. You can search them up. The issues are you can over medicalize lifestyle. Lifestyle is a very unique and personal thing. You don't want to medicate it too much. So if you tell people to take vitamins, right, for example, they shouldn't, not everyone needs vitamins every day. So you can over medicalize stuff. And also some people or some patients take these public health measures as treatments, which they aren't. Uh, okay. And a last point again, like you mentioned, money issues. This is a really common issue, but there's not enough money to run these public health campaigns. So it's a balance of prevention versus treatment, and not everyone will be treated equally. For example, the postcode lottery, like we said, you can't tell people to get off a stop early and walk to your next stop if they live in the Peak District, where each stop's like a mile apart. Whatever it is, not all of these ideas are equal for everyone. Okay. Next up, we've got sugar tax and energy drink ban. This is a really simple one. I'm sure you've all read up on this. The government is now taxing people if they put too much, or taxing companies if they put too much sugar in certain stuff. For example, energy drinks. If energy drinks have too much sugar, they have to pay a tax, a small fee to the government. What does that do? It means there's less sugar in these drinks in the first place. It lowers obesity, dental caries, etc. This is a medical and dental hot topic, by the way. And there is evidence for this. Mexico started this a lot earlier on, and this led to a 12% drop in the purchase of sugary drinks. I'm sure you guys have seen your Monsters, your Red Bulls are more expensive compared to your waters, right? As simply as that. Um, okay, and again, similar stuff. It saves cost long term. If you can stop people from showing up to hospitals, like I said, it's cheaper than treating them later on down the line. But there are drawbacks. First of all, is autonomy. Is it fair for the government to control the prices of foods that we buy, right? People, I mean, people are adults. They don't have to be told what to eat or not to eat. So is it fair for the government to decide that for you? That's one thing to consider. And the idea of this is paternalism. You can search it up. I'm sure there's a lot of articles about this. And the second thing is progressive impact. This it should be equal for everybody. However, it disproportionately affects low income groups. For example, low income groups often buy more processed foods because organic foods are more expensive. Okay, if the government makes these processed foods more expensive, well, what will they eat? Right? Simple as that. Or, for example, it's quite expensive to buy
Yeah.
the best vitamins, right? But
One
if you
sec, I'm on
make
a Zoom call.
okay, sorry. Yeah, it's it's expensive to buy. Oh, I lost my train of thought. Never mind, it's fine. But yeah, so back to the low organic food example. Um, it's more expensive to buy organic food compared to like fast food, junk food. If the government control the prices, it's not fair. And last up, obesity is multifactorial. It's not as simple as you eat a lot or you don't eat a lot. There's genetic issues, there's a bunch of issues around this. So it's not really fair to control somebody's food and stuff. Okay, Mufti, next up we've got AI and medtech. This is really prevalent, especially now. I'm sure you guys have seen this enough, ChatGPT merchants. But AI is I'm not going to explain. You guys know what AI is. MedTech is using technology to improve patient healthcare. Yep, Nagi, that's correct. So if you do a lot of these prevention programs, it limits autonomy and it's not really fair at time. So it's a justice and autonomy balance. Okay, MedTech, like you said. Yeah, there's more dense slides afterwards. MedTech, again, like I said, sorry. One of the big examples is radiography. X-rays are one of the big things that doctors use. It's a big tool doctors use, but it takes ages to get them read and typed up and sent over. NHS now uses AI to help with that, and it speeds up the imaging time. It speeds up or it reduces the stress on doctors, etc. So AI and medtech has its benefits. It does help. It speeds stuff up. It helps with admin tasks, triage, etc. But there are risks as well. I'm sure you guys have all seen that when the NHS got hacked and they couldn't treat patients because there was nothing to do with, like, all the systems were online. That's a big thing. IT failures, data breaches. The other thing is AI doesn't have a controller. So if something goes wrong, who's in charge of that? If the AI says you have cancer and you don't, who do we blame? Right? So that's one of the big issues. And then biases. AI does have, or algorithms do have biases, which is you can't really change that. So that's something to consider as well. The ideal world is you have a balance of them where you have AI doing the tasks, you have a doctor kind of just checking over it, making sure it works all right. Okay, so it can widen the inequalities. Digital divide. Who knows what that is? What is the digital divide? Just briefly. Go on, Ziad.
Okay, so digital divide is the difference in the so different areas of the UK have different income. Therefore, some areas of the UK, such as London, may have access to better technology. For example, better computers, better um, iPads, better resources that will help them maybe go on to have online video calls with their doctor. Whereas areas such as up north, where it's more of a low income area, you would have people with less able to maybe have devices, so they maybe go to a library to receive the support they need in
Okay,
terms of that.
exactly. Perfect. So, is disparities or differences in the use of technology and the access and accessibility towards it. Like DC had mentioned, your unc, like Mufti, we can't use AI as well as we can, right? Because we're young. But that's one thing to consider. So, it's really unfair to some people because they can't use it as well, especially older population, etc., stuff like that. So that's one thing to consider. Also, like you said, certain areas have less access to technology and stuff like that. So, again, it just widens the inequalities. If you do stuff online, people can't access it. For example, I'm not sure if you guys know this. This is one I mentioned in my interviews, which is that the NHS had a whole like dictionary online where it has literally every single disease known to man with like symptoms, stuff like that. But it's all online. All people probably don't know how to use that, and they probably won't find it, which means they don't really know how to treat themselves earlier on. So that's one example you can mention. You can just steal it from me. But yeah, so balancing innovation, balancing advancements in technology with patient safety, ethics, and NHS resources. Perfect. Okay, some questions now.
Sorry, another example I'd give as well for this is that in healthcare, what we have is databases. For example, we may have health charts that talk about what's a healthy level of potassium in your blood and what's an unhealthy level of potassium in your blood. Now, the data that they collated for that could have been done on a certain population. So let's say this experiment was done in America in a predominantly white population. If you get a patient from a different ethnic background, due to genetic factors from those ethnic backgrounds, they may have a different range of healthy ratio of potassium in their body, which may not be applicable for the one calculated by the data. So even data acquisition is there's inequalities in that as well. So we have to make sure that we get population size accounting for all ethnic groups. Okay, cool. Okay, guys, it's your time to practice now. We're going to give you guys a go at attempting some of these questions. We've got 2 questions for you guys to have a go at. This is relevant for both medicine and dentistry. We want to see you guys their hands up, and we're going to have a go at practicing this. I'm going to time you guys now because we're getting very close to your interviews. A lot of you guys have it literally in the next couple of days. And so what we're going to do now is time you guys for 2.5 minutes. And after that, we'll cut you off. And then we're going to give you feedback, okay? Cool. Going to give you guys a bit to time to read the chat. Ziad, can you find? I'm sorry. Abdullah, can you pick someone to answer that isn't Ziad because he's already
Yeah,
on?
Omar, I've not seen before, so we'll use Omar.
Okay, thank you. So 2 minutes and a half to answer, huh?
Yeah. Whenever you want to start,
Okay, thank you.
you can take a bit to read. Yeah, Omar is very OP.
Okay, so thank you so much for this question, and I've had a little bit of a think about it. And how I'm going to approach this question is thinking about both the short-term and the long-term factors to take into account. So essentially, in terms of the long-term factors, I would personally suggest that I would input and invest a lot of money into preventative dentistry. And one of the reasons for that is because it allows patients and individuals to learn about their oral hygiene and react to it proactively and not reactively. Essentially, knowing to brush their teeth twice a day, to not spit out the toothpaste, not rinse their mouth, and to be able to take care of their own oral hygiene and not risk going to the dentist or risk getting further issues and further problems. For example, when they would need a filling, and then that could progress further to a tooth extraction. So it could also reduce strain on the NHS. As we know, the NHS currently has a backlog of appointments. Due to COVID-19, there was around 20 million backlog appointments. And just now we're seeing the impact of that due to the NHS waiting times. So that's one thing that I would consider, preventative dentistry. And in terms of the short form, short-term factors, I would personally consider AI. And one AI that I've been looking into is a note-taking AI, essentially an AI that allows dentists to have a consultation with a patient, and the AI takes notes for the dentist. And one risk of that could be the fact that if that AI makes a mistake, who's going to be held accountable? Is it going to be the dentist, the AI company, or the GDC themselves? So that's another thing to take into account. However, one advantage of that would be the fact that it would reduce the waiting times. It would allow for rapport building with a patient and being able to allow that patient to trust the dentist and to build a relationship with them. So that's another factor that we can take into account. And then a third thing that I would mention would be, for example, dental vans. So yeah, so I think we can invest in dental vans, and they can go around to dental deserts and provide treatment there to reduce social inequality. So that's another thing to take into account. Overall, I think I would invest in preventative dentistry, dental vans, and AI.
Brilliant. Thank you for that, Omar. So, how do you think you did, Omar?
To be honest, not too good, but at least I had a structure.
I mean, for your standards, yeah. But I think overall, it was a well answered question. I liked your structure. I like your flow of speech. Guys, in the chat, can I please get what you guys think you did well on? Let's get some ideas, guys. Yes, good signposting. So we talked about specific topics towards the start that he's going to focus on, such as his preventative dentistry. Then he went into examples. Good structure. Exactly. He included pros and cons. So he went on both sides of the argument. He always introduced the topic to me, and then he talked about what the pros are and what the potential downsides can be. And he also gave a nice summary towards the end. He missed a chance to mention that £1 of fluoridation saves £22 in treatment. Yeah, that could have been a nice little touch to it as well. Confidence, flow, and yeah, I think it was very well answered from that sense. Thank you, guys. Okay, where do you think Omar could improve, guys? I wouldn't quite say work experience. This is a hot topics question. Although what I could say is potentially, if you do have any anecdotes, perhaps mention them as well for your work experience. But I don't think it's the biggest concern. Talk about how much money goes into NHS currently. Yeah, so I think if you talk about perhaps where the NHS is already investing and how it can be altered, it gives you a bit of a sense that you have an understanding of what's already happening and why there could potentially be issues with it. So you could talk about, I know that the NHS dentistry has a long-term plan to focus on preventative dentistry because previously, in previous years, they focused more on treatment-based and restorative dentistry, which had a short-term benefit and led to worsening oral outcomes from patients. As a result, it's important that they begin to focus more on preventive dentistry. Perhaps you could preface the start of your answer, your first point on preventive dentistry like that. Mentioning the challenges of mentioning challenges of the strategies. You could also talk about, now this may be difficult to do, for example, dental vans that you talked about, going to dental deserts, perhaps because of equipment. On top of that, it could be due to factors such as high cost to overall benefit and perhaps low accessibility. Many patients may be unwilling to receive treatment from there. So you could talk about that as well. I think this answer overall was very well rounded. Okay, Omar, really well done. I'd say the only thing I would do just to round up a little bit is talk a bit more detail about your last point about dental deserts. You sort of left it a bit bluntly. On top of that, talk about specific challenges you'll face and try to give an understanding on already what the NHS is struggling with. Yeah? Okay, cool. Brilliant. Thanks for that, Omar. Very well done. We're going to move on to the next question. Abdullah, if you could pick someone to have a go at this.
Oh, my bad. Sorry, Barton, your hand was up first before, so
Okay,
Barton,
thank you.
You can take your time whenever you want. Start the timer.
So telemedicine is a really important part of medicine, and it's increased in popularity since COVID-19. And it's basically the aspect of medicine which takes place online or through communication over the phone. There are a lot of pros and cons for telemedicine, and some of the pros are that it's convenient for patients who live in rural areas, and it can be used to combat the postcode lottery. And I think all of this is important to ensure that justice is carried out for every single individual across the country. Telemedicine is also cost effective, and it can also be less anxiety provoking for individuals as they don't have to face the doctor face to face. It can also be more cost and time efficient, and it can reduce the risk of disease transmission. It also allows staff to work whilst immunocompromised, which is really useful as the NHS and other healthcare systems are also already understaffed. However, there are also a lot of cons that come with telemedicine, which are such that it limits privacy. So, if you're at home or at work, there's the risk of other individuals overhearing. Additionally, there are certain individuals who might not have suitable devices, and you must ensure that patients who don't have the devices or the capability to use the telemedical equipment aren't disadvantaged. Additionally, there's also the loss of social interaction, and it's harder to form a doctor patient relationship, which might make it more difficult to receive vital information from the patient. And there's also no physical examination, which might lead to missed symptoms or small things like a small rash, which might affect the overall prognosis, but they're missed, and therefore it might cause further issues. So overall, I think telemedicine is a good way to improve communication and help a lot of people who might struggle to go to the doctor physically. However, it shouldn't become a complete alternative for in-person appointments.
Brilliant. On the dot. Perfect. How do you think you did, Fatima?
I think that was quite good.
Yeah, what does quite good mean?
But I think I did say a little bit, a bit too much, and I did think I stuttered a little bit.
Okay, yeah. I think overall your strong clarity, which is what really stands out to me in your answer. Your clarity was top band. It's really up there. You got your point across. You were simple. You didn't beat around the bush, and you were direct with your answer, which is what was clear. So yeah, you did say a little bit. That can come with practice, a bit of improvement in your speech, perhaps thinking for a bit longer. But other than that, it's really up there. Guys, in the chat, can I get ideas of what she did well? Yeah, everyone's really liking this answer. Congratulations. I think she made up for the oral loss. Extremely holistic. Yeah, so she considered all factors, such as patient factors that are considering things such as older patients or those with mobility issues and those from areas within certain regions of the UK which have less accessibility to transport. So it was very holistic, as well as many pros and cons listed. She did go into them as well. Clear answer. She defined what is brilliant. Now, one thing I really liked about your answer is that you defined it. You gave an introduction of what telemedicine is at the start. You gave your pros, you gave your cons, and you finished with the conclusion. The structure was really up there. You followed exactly what we talked about at the start of the webinar, which I'm just happy that at least one, my goal for this webinar was that one person learned that structure. And honestly, I'm happy with that. So yeah, really well done there. Okay, what about where you could improve? Any ideas, guys? Where can she improve here for answer? Really take it to the next level. Propose solutions to certain cons. Exactly. Having that solution-based approach. So you talked about how in telemedicine there could be essentially, difficulty in transport. So you could talk about perhaps more investments because we're shifting towards a time of telemedicine, more investment towards transport services, towards hospital-specific transport, something like that. And slow down our answer, perhaps a little bit. I think the main overall benefit she could really focus on and take from this, I think the answer is good. I don't want to give too much feedback because I want to really to hone in and focus on those strong points because they're good enough as they are. But just to tweak it up a little bit, I would go into a bit more detail with some specific ones. You mentioned a lot of bullet points, but you didn't quite go deeply into them. And you didn't consider the psychosocial aspect from that as well. So you talked about the postcode lottery. It decreases access, and therefore it can reduce the patient-doctor relationship within certain areas, and therefore create healthcare deserts within those regions. This may have impacts onto patients within their social life and affect psychosocial aspects of a patient life, such as their confidence and mental health, things like that. Go into perhaps a bit more detail with some examples. You touched on a lot of things, perhaps really hone in on a few more. But yeah, And Musa also talks about the NHS long-term plan, which you could talk into. But yeah, I think it's really we've had two top band answers so far. We've got more questions coming up, guys, as well. So we're gonna touch into those too. Okay, cool. Abdullah, do you have anything to add?
No, that's pretty much it. Yeah, like you
Okay,
mentioned.
cool. We'll try to whiz through everything, guys, because we've already gone over time. But yeah,
Okay, this is more for the dentistry stuff, but it's good to know regardless. UDAs. UDAs are units of dental activity, and essentially it's a token, right? It's a standard way of measuring how much work a dental company has done for the NHS. The reason we need it is because most dental clinics are actually private places that are contracted by the NHS. So the way we have hospitals which are fully NHS, dental clinics are private clinics and the NHS pays them to treat an NHS patient. Does that make sense? Okay. So there needs to be a way to standardize that payment. The way they do it is UDAs. There's three bands of UDAs, band one, band two, and band three. Band one is the lowest band, and that's basic stuff like a routine checkup, diagnosis, x-rays, emergency appointments. Essentially, it's basic stuff. Band two is band one, plus on top of that, fillings, root canals, extractions, that kind of stuff. And band three is band one and two, plus crowns, dentures, and bridges. So each treatment will fall into one of these categories. Now, each band is worth a different number of tokens. So band one is one token, band two is three, and band three is 12 of them. And as a rough average, each UDA is roughly £28 for the practice. And from that, the dentist will get a percentage of a commission from that. Now, the NHS pays people, or the NHS pays these practices based on the type of service, not the quantity. For example, let's say the first patient shows up, they get one filling. So that for that treatment they'll be paid band two, so three UDAs. Let's say another patient shows up and gets 12 fillings. That patient will still get three UDAs because it's the same treatment. Does that make sense? So the quantity doesn't really matter. Okay, so dentists have a certain number which they have to complete. Generally, this is 4,000 per year, but it does change per place. And that's in their contract. They have to get to 96% of that at the bare minimum. So they have to be within 96% of their total number. And that's the way of balancing the private and the public healthcare aspect. Does that make sense? You don't need to know the exact numbers of like how much they're paid per band, just know the rough idea of how it's structured. Okay, now the second part is who's exempt. Not everyone has to pay. So the first thing is under 18. Anyone under 18, so any child, does not have to pay for their dental treatment. Or if you're under 19, but you're in full-time education, so university, sixth form, etc., you don't have to pay. The next people is pregnant women and people who have had a child in the last 12 months. They don't need to pay either. Also, people who are sent from NHS hospitals to be treated by a hospital dentist don't have to pay. Specifically, a hospital dentist, so not a private healthcare place. And the last one is people on universal credits or benefits. So this is the NHS way of making it kind of justice and equal for everyone, because you otherwise kind of anybody else outside of this has to pay for their treatment. So it's a small fee which they pay to the NHS for the dental treatment. Okay, next up we've got cosmetic dentistry. This is probably the biggest dental topic, I would say, especially now, because there's so many things which come into this. The reason is, or the big reason is social media. You see all these influencers, celebrities with the perfect smile, which generally isn't really true. It's not real. It's not a real smile. They often do teeth whitening, aligners, veneers, braces, all that kind of stuff. And that's causing people, especially younger people, who see these influencers want to be like that. And there's a bunch of issues regarding this, but it causes a demand or a drive for that perfect smile. The first thing is autonomy. Patients are allowed to choose, right? If a patient wants a perfect smile, they want a perfect smile. That's fine. But how do we balance it and balance the price and the effects of that alongside the mental effects that it will have on the patient? So that's something that doctors have to consider and dentists have to consider when they're doing this. GDC principles, I'm sure you guys know the 9 principles. I'm pretty sure the first one is literally put patient's interest first. So literally, if the patient wants this, you give it to them. It's expensive, however, it's not cheap. And there's ethical issues behind this. The first one is well-being. This has loads of mental health impacts on the patient, right? You'll see people get bullied for their teeth, teeth coloring, braces, that kind of stuff. And it does improve patient confidence. It improves their social life, biopsychosocial model. You can link it really nicely. But also non-maleficence. You can overtreat people, right? Veneers aren't good for your teeth, or some veneers aren't good for your teeth. So you can actually harm yourself by trying to do a good thing, damage unrealistic expectations. Teeth whitening will never make your teeth like pearly white. So it has that impact of it as well. Social media is a big issue, trend and stuff. Yeah, biopsychosocial model. So you can no biopsychosocial model. It ties in really nicely to cosmetic dentistry. So yeah, these trends on social media really does affect patients and it can cause mental health. This is a really nice link to mental health as well. Big thing is equity of access. Who deserves treatment? In the UK especially, cosmetic care is especially private. It's mainly private. And the NHS currently does not pay for it outside of braces. So braces isn't treated as cosmetic, it's more of a like a treatment. So the NHS doesn't pay for private things, but it's unfair. People who are from a lower socioeconomic background cannot afford this. So they still suffer from that same mental health issues, but they can't afford it. So does NHS pay there? Something to consider. Something there's pros and cons. You can argue about it. The last big point is dental tourism. This is a really big point. This is for medicine as well, but it's slightly different. But dental tourism, which is where people will go abroad to places like Turkey, I'm sure you heard of Turkey teeth, and they try and get dental treatment for cheaper prices or because it's easy to get. That's good, but there are drawbacks. The big drawbacks are that often these treatments will go wrong, and then the patients comes to the NHS with more issues than they started off with, which is more expensive than if they just gave you the teeth whitening in the first place. So that's one of the big issues. Also, there's less regulation in these other countries and more chances of damage as well. So there's things to consider. Also, it's widening the inequality gap as well. So research dental tourism. Medical tourism is also a similar thing. You guys have heard about kind of Digitas, which is where the people who want to get euthanized go to Switzerland. And there's other examples as well. Research on medical and dental tourism because it's a really common thing as well. Okay, that's our dental hot topics. These are the big ones. There's a few more you can research them in your own time. Mufti.
For those of you guys who are new, please join from our WhatsApp community from this QR code. I'm sure most of you are already in it, but I definitely recommend you guys to join this. This will have all of our hot topics, webinars, and medical dental interview support available. On top of that, we're going to have loads of other webinars, support from medical dental students across the whole UK. So we've got students studying at most UK medical and dental universities. On top of that, we'll update you on any other mock MMIs, circuits, opportunities we have available for you guys. Definitely do search this up. On top of that, there's opportunities for us to visit your school, which will be really nice too. Okay? Cool. Right. So we're going to go into questions now. We've got 2 questions. In the interest of time, I'm only going to give you guys the opportunity to answer one. So could I ask someone to have a go at this? Abdullah, could you pick someone for me?
Hands up, I'm going to just pick someone. Ziad cannot be the only hand up. Surely.
Guys, Ziad answers every single time.
Yeah,
That's
Ziad's
the
our
soft part.
consistent. Okay, there you go. Fatin. Okay,
Sorry,
go on.
Ziad. Would you like to?
You put
Are
the
you
hand
medical
down.
or dental?
Where
I
are you
have
going?
medicine.
Oh, there we go. Okay, that's fine.
Are you studying medicine or dentistry?
Medicine.
Okay, brilliant. You can have as much time to think as you want. Let me know when you want to start, and we'll begin your timer.
Okay, thank you.
No worries.
Okay, I'd just like to start now, if that's okay.
Yeah, brilliant.
Okay, first of all, let's start the answer by actually introducing the idea of obesity, as I believe that obesity at the moment is categorized as those who have a BMI over 50. Currently, obesity has become a huge epidemic, or pandemic rather, for children specifically in comparison to adults. The NHS has placed a variety of different strategies, such as having medical staff actually promote different campaigns, such as the Eat Healthy, and kind of giving information to parents about what they can do to help their children lose weight and actually offer financially suitable alternatives, such as going out to parks. Furthermore, I am aware that many other medical staff members, such as physicians, are actually also offering free consultations, both for parents and children, to be able to understand what obesity is and the way to tackle it. As in many ways, there is a stigma for families around the UK to reach out when they're struggling, as many misunderstand obesity as being done as only a consequence of lifestyle choices, where in reality there are a variety of different health issues that the person may be struggling with that lead to this. In future, I believe the NHS can implement new strategies, such as those actually helping with mental health. A variety of those who suffer from conditions such as depression and anxiety may fall into a spiral where they are unable to take care of themselves, leading into weight gain. This is no fault of their own, and the NHS can offer online support groups as well as in person. This makes that actually fits in with the ethical pillars, as it ensures justice. Everyone's able to access this sort of strategy instead of just being limited. In conclusion, I believe that the NHS can implement strategies such as having support groups, which, yes, may be challenging to implement initially, as many only actually have the courage to face others and kind of admit that they may have a problem or that they need to tackle an issue. But it can be a huge benefit and can fulfill a variety of ethical pillars such as justice, beneficence, and as well as non-maleficence.
Brilliant. Okay, Fatin, how do you think you did with this?
I don't think I did as well with this question, but I gave it my best attempt.
No, it was a really good attempt. Well done there. Can I get ideas in the chat? How do you guys think she did? What pros do you think she had? Let's get some ideas, guys, in the chat. Very clear structure, a good flow, and a nice conclusion. Yeah, so she introduced the topic. She went into what strategies the UK is implementing. She also appreciated that certain strategies were difficult to implement, such as support groups. And at the end, she gave a nice conclusion. And based on that, it was very well answered. Also, you guys have said it's very well detailed. Yes, she did have a good introduction. And she also talked about how the different ethical pillars link to that topic. So overall, her format was strong. She talked about many of the different ethical pillars and the format as well from that side of things. Where do you guys think she could have improved in her answer, guys? Let's be critical here. Sounded slightly scripted. Perhaps she did talk about quite a lot of things. I think what we can say to deal with this one in particular is really pick a few specific points that you want to mainly tackle in your answer, pick on them, and develop on how they impact the different all 5 lenses of the NHS. Really delve into the 5 lenses approach. Maybe that's what she could work on. A little monotone. Perhaps a little bit monotone. I think she was definitely clear in her speech, which is very important. But to take it to that next level, you could have different intonations in your voice, sort of like how I'm speaking right now, or how you'd normally speak with your friends. You'd have different intonations. I think that would help. A few pauses as well, because your answers were quite continuous. Yeah, that's a nice suggestion. And yeah, okay. So people are really appreciative of your answers. I think all 3 answers we've had today have really been top drawer. So well done, guys. Honestly, you guys have really smashed it. Some key tips I'd give for this answer. It was well answered. You talked about many of the different 5 lenses. What I'd say is don't make it so ethical pillar focused. You talked about autonomy, beneficence, non-maleficence. You were centering your answer around them. Never center your answer around the ethical pillars. Center your answers about the content, the points that you have. Then link the ethical pillars towards that. If you do it that way, you're not making it look like a tick box activity. I think that's what people are trying to point out in the chat. It sort of looked like a bit of a tick box activity. Go with many of the topics you're talking about, such as the support groups that removes justice. supporting the ethical bill of justice because it helps reduce inequalities. Okay, that's one thing I would say as well. On top of that, you talk nicely about the biopsychosocial model. And I just want to make this a bit clear as well because a lot of people have asked about it. All of you guys who want to elevate your interview answers to the next level, always link in the biopsychosocial model. Biopsychosocial. Whenever you're given a patient in any station, reuse this, rinse this technique. In my interviews, I reuse this in multiple stations. Whenever they give me a specific patient, consider the biological aspect. So obesity. What's obesity? It increases the prevalence of diseases such as cardiovascular illnesses. We spoke earlier in this webinar about the healthy life expectancy being so low. If more people are becoming obese, they have an increased risk of developing chronic diseases. That is the biological factors, disease, death. Now we're going to move on to psychological factors. When someone's obese, they don't become obese overnight. How do they become obese? It's a health habit. It happens as a result of stress eating or stress factors in their work life, or perhaps things like COVID, which is restricting movement, or perhaps illnesses, or let's say they fall ill and they can't exercise. So there's multiple factors that impact it. Spend a bit longer with the patient. Understand the psychological factors. Signpost them to support groups or support systems available, therapy, or any other healthcare staff like dietitians. Okay, biological factors, psychological factors, social factors. What's the impact on society? If a greater proportion of the UK is obese, who's having to pay for it? The NHS has to pay for it. Who pays for the NHS? All of society. Therefore, we want to reduce inequality to reduce the cost on the whole population. Okay, biopsychosocial model. This is for everyone. Do this, your answers will be top model. Okay, you can do this for any station, but don't do it for every station. Only do it for the stations in which there's a patient, or there's a specific hot topic, or there's someone being impacted. Don't do it for like motivation, for example. I know some people might actually end up doing that. You'd be surprised. Some people will just mention in their motivation station. Keep it, follow the structure. Go watch that webinar. But yeah, you don't have to specifically, you can mention the model, say biopsychosocial model, but you could just mention it off the top. It wouldn't matter. But yeah, Fatan, really well done. We've had top draw answers today. And yeah, Abdullah, would you like to add anything?
You covered pretty much everything. So yeah, nothing to add.
Yeah, we were quite in detail. Okay, and this was the dental question. I'll leave this one up for you guys who watch the recording to do this in your own time. But for the interest of time, we're going to move on. Okay, so the next things I want to talk about. You guys have your A-levels coming up very soon as well. So it's very important that you guys maintain a good balance between doing your A-level preparation and your interview prep. So your interviews are coming up very soon, and that is more urgent. So I definitely recommend you guys to focus a bit more on your interviews, but never neglect your A-levels. The system I followed to achieve 3 A stars in my A-levels and in my mocks, whilst preparing for interviews simultaneously at the same time, and this is something Abdullah can also tell you guys, is time management. Now, I know that sounds very generic, but here's how you're exactly going to do this. It's a very common question we get. The time you're in school, dedicate that specifically towards your A-levels. Once you do that, you know that at least you won't fall behind. It's not about revising. Sure, you won't revise everything. Sure, you won't be doing past papers all the time. Sure, you'll be a lot more busy, but at least you're not falling behind. Because the minute you fall behind, a huge backlog develops. I'm saying this even in medical school. If I miss one lecture, I promise you guys, there's a huge backlog. And then I may or may not be in a backlog right now for medical school. But anyways, that's besides the point. Okay? There's a huge backlog that will build up if you keep missing your A-level lessons. Okay? So that's one thing I definitely focus on. Then when you get back home, so after school, that's where you want to do your reading. That's where you want to do prep with your friends after school, the library, or perhaps a Zoom call like, hey, let's practice 30 minutes every single day after school on Thursday, 8 p.m. Be specific. Set times with your friends. This is the strategy that's going to help you. We have a tuition portal system up called Medentors Academy. On this, what we'll do is pair you guys with a tutor specifically for your subject. So if you're looking to do medicine and you're struggling with biology or chemistry, we'll pair you with a tutor specifically for biology or chemistry. So you guys can book a free consultation with us using this QR code to scan in. I'd highly recommend it. All of our students have improved their offers, and this is a really good scheme, really to push for those A's and A stars. And this is also applicable to your GCSEs. So definitely have that up as well. Okay? Okay. A lot of you guys have been asking about the Medentors mock MMIs, and I'm very happy to announce that we are continuing our circuits. So we're going to be continuing more circuits for our MMI, and this will be our 5th series of MMIs for this cycle. So what will be included in the Medentors mock MMI? You will be given 6 stations, And on top of that, there will be some rest stations as well. These will be realistic, high yield, and we're going to be using actual interview questions that have been used in previous years. On top of that, you'll be given feedback for every single station. So at the end of every station, there'll be feedback. Now, the way these scorecards work and the interviews work is you'll be given a score out of 120. So every station will be scored out of 20, and essentially you will know which one to focus more on and which ones to focus less on. On top of that, it's not going to last too long. It will just be 75 minutes. We'll have a little briefing to get you guys into the flow of the MMI, the circuit, the rest station, and after that, we're going to do a quick summary where the mentors are going to break down all the key mistakes that they were running into per station, and you'll be given a feedback document out of 120. Now, for every single one, there'll be competencies written down with the mark scheme, as well as improvement points and strengths. I'd always recommend you guys that for these MMIs, get your phone out and voice record yourself answer so you can actually listen to your mentor's feedback. And on top of that, I'd also recommend you guys to really work on those green points as well as those red points, because the green points are the ones that you need to improve on. As you guys noticed in the feedback whilst I was giving it to you guys as you practice with me, I told you guys, really hone in on your strengths, play to your strengths. That is where your answer stands out, because that's what makes your answer unique to yourself. Now, what we've done as well is that there's an offer where you guys can invite a friend with you, and there's a specific discount for that. So there'll be more information posted on that soon. I haven't posted on the chat yet, so if you guys get it now before they get it, the offer may still be up, hopefully. I'll post on the chat soon. That's when it will probably all be gone. And as a result of last year's success, we are pleased to announce that 95% of our students managed to get into UK medical dental schools. And a lot of them are working on our team right now with us. So that's one really good thing as well. On top of that, we've run these MMIs in schools as well and worked with many partners, okay? So definitely do check out this opportunity. I'll leave this for a while, okay? Cool. Okay. I'll put the link in the chat as well for you guys to access. This will be on the 18th of January. Okay, so any of you guys who have interviews in February, perhaps look into that. Okay, guys, so what is next? We're going to continue our webinars, okay? There's going to be perhaps 1 or 2 more webinars. We're just going to go through many of the high yield points that you guys are struggling and making mistakes in for year 13. After that, we might do some A-level catch-up revision sessions as well. So keep an eye on the A-level chat. We'll have some resources out for you guys as well. If you guys are looking to take a gap year, or if you have any friends in the year below, please add them to our year 12 community. On there, what we're going to do is build up on many of the hot topics. We're going to get them started with their work experience. We're going to get them started with navigating through their interviews, which are going to come later, but obviously the supercurriculars, extracurriculars, personal feedback. I would definitely recommend you guys. So please keep an eye on that. The year 12 group chat is on the same community. It's just a year 12 one. So add all your friends to it. It's super high yield. And now it is time for questions and answers. Me and Abdullah will be helping you guys out here. For questions regarding NHS, can you mention the other side of things? That's a good question. Jan, you're doing dentistry, so I don't know why you're asking that. But yeah, you can. Why not? Apart from mock interviews, how else can we practice? Okay.
So
Yeah.
this is something that I used to do a lot, because what I used to do was you get a question up and like a flow chart or like a mind map, whatever it is, write down what you would mention. So for example, let's say it's a question on ethics. Draw 1 arrow or your first point, second point, third point, whatever it is, and do that in like a minute. Time yourself, like rush through it, and then get a mark scheme up and compare what you wrote to what the mark scheme says. That's the way that I did it, because speaking it isn't too hard. I mean, once you practice enough, it's natural. So the speaking part isn't too deep. It's more about the content and the ideas behind it. So that's the way that I did it. Mufti, do you have anything else?
Yeah. So is this the one on mark scheme answers?
No, this one that I'm gonna say about, apart from mock interviews, how
Oh,
do you
okay,
practice checking?
That's a good tip. But one other thing I'd tell you, there's no such thing as a model mark scheme answer. It's not a specific specification that they're looking for point. Pick 1 or 2 points. Literally, you have 2.5 minutes to answer. You're not going to go through every single point. The biggest mistake students make is they become mark scheme warriors. They have bullet points that they want to pick out everything. You can't go into every single point for a specific topic in detail. Pick 1 or 2, go into them in detail, cover the 5 lenses, tap into the biopsychosocial model, link it to medicine, link it to the career, link it to what are the long-term impacts, the short-term impacts. That is more than enough. So obviously check and read our guide and read the UKCAT people guide and all the ones that are available. But on top of that, be realistic and super deep. Go deep. Go deep. Don't be superficial. Don't stay back from the answers. Go deep into a few specific points. That shows you actually understand it. That you're not just memorizing things. That you have appreciation. This isn't like A levels where there's a mark scheme and it's a race to see who can mention the most points. Okay. Cool. I have a week till my interview. How can I cram to prep? But just binge watch our webinars, man. Honestly, yeah, it's kind of your own fault there. In reality, what I'd say is try to read our guide to have an understanding of the different hot topics and then just practice as much as possible. You should not have left it this late, but obviously that can't be avoided. So I'd recommend you just get as much practice as possible because half of interviews is just preparation in terms of confidence. So really build your confidence, and that's the most high yield skill you can build in a week, not knowledge-wise content, because that it takes a lot of time to come up with. Okay.
Also, research your uni and see what topic or what stations they generally focus on. Make sure you do more prep in those and just do as many questions as you can because questions will get you the practice and the confidence that you need. So, yeah, UCAT questions. Are you year 12?
Oh yeah, for UCAT questions, use the
Okay,
official UCAT website. They're really good. Abdullah's like the UCAT expert here, so he can give you some tips.
yeah. I would say, first of all, don't worry about it too much. Focus on your year 12 marks because those are really important. But if you do want to get involved and get ahead, also don't stress because UCAT isn't, it is deep, but if you work on it too much, you just burn out. So don't do too much either. I would say you can go through some brief questions, just do some practice. UCAT question guide, like Mufti said. And because you're not really doing proper prep right now, even PMT has UCAT questions, which, I mean, obviously they're not perfect, but they're good for like just to familiarize yourself with a rough idea of it as well. I would say leave the official marks and like Medify and entry and stuff for your actual prep. Okay. Muslim asked, how would you deal with the question? How would you deal with a patient or colleague questioning your decisions and maintaining confidence? Uh, oh, Mufti, you want to take that one?
It's a really good question. So if
Yeah.
someone questions your decision, firstly, we have to understand the hierarchy as well, and we have to understand the severity. Let's say you're mid-procedure and someone asks you a question like, "Oh, why are you doing it this way?" Perhaps consider, are they your senior or are they junior to you? If they're your senior, they're likely trying to advise you. And in the training scheme of the NHS, they're likely supervising you and therefore they're informing you on what decision you can make. So perhaps you're going to pay more attention to them if they have a supervisory role over you, as your decisions impact them as well, because anything that you do will be impacted by them. However, if it's someone who isn't senior, or if it's just a patient, let's say, I don't know, asking, "Oh, why are you prescribing me this medication or this medication? I read about this." The way you'd go about this is by acknowledging that. Oh, thank you for asking that question. It's a really good question. And be really open with them. Firstly, thank them and say, "Oh, that's really good that you're thinking about this for a patient. Essentially, I'm doing this," and then explain your rationale behind. I'm giving this medication because there's a chance you might be allergic to this, and this one's run out of stock. And they both work the same way, but this medication is better for your specific case because of your age, your group, and this is a specific reason why. If a colleague asks you a specific question on why you're doing this, again, it depends on the urgency of the situation. If you're mid-procedure, then it's probably best to not engage with them. But if they're asking you, "Oh, why did you prescribe this patient this and not this?" So you'd sit down and explain. So this is why, this is the guidelines, and this is what it's explained to me, and explain to them in one way. Another thing we have to understand in medicine is that there are multiple different approaches to the same outcome. There's multiple different ways to perform the same surgery, and it personally depends on your preference. So depending on who is leading a certain procedure, they essentially decide what way it's carried out in. So if you're following a procedure, if you're not leading a surgery, let's say, and you're just witnessing, your role is to follow them. But if you're the leader of a certain scenario, you're the one who will lead and decide what method is used. Okay? I hope that helped answer your question, Musa. Well, guys, we're just going to answer a couple more questions. Any more we can answer in the WhatsApp chat, so please do leave them there as well.
Yeah, for the uni specific ones, I think just message on the group chat. Yeah. Okay, this is a new one. The interview stations where they give you an article beforehand. First of all, make sure you get the big ideas on. And then for all kind of data questions, like a graph, article, whatever it is, start off simple, right? Explain what it's talking about. The axes, the titles, headings, whatever's going. Be very like general. Then give a general overview. So, for example, this article generally talks about blah blah, or the graph generally shows this. So be general. Then zoom into specific thing. Have a structured approach, and it will really make your answer work a lot better. Uh, your questions.
Tips for interviews, they give you an article prior. It depends on what instructions they've given you. I know Queen Mary's do this as well, but read the article, consider the 5 lenses, do a bit of wider reading on specific topics and advancements on that specific field. So let's say they start talking about something like, I don't know, I'm just making it up, like vaping, for example, and vaping policies. Read into the research that's gone into it, evidence-based research. Read a couple of articles, like scientific literature articles, and what they're saying, what the conclusion is. When you get a scientific literature paper, just read the abstract, and that tells you everything you need to know, basically. And just quote some figures. And then you can sort of bring it back in your answer. I think that's one really useful thing. On top of that, what you could do is talk about, as I mentioned, the 5 lenses. So really hone into how it impacts every single person. So for the article, consider the 5 lenses, do some research on what evidence-based research that's actually out there, like articles. You can find it on Google Scholar. That's a really good site to find research articles for specific topics. And just talk about what you think the next steps are. I don't know what they're specifically asking for, but that's what I think about. Okay.
Any final few questions, or I don't see
Yeah, any
anything
questions,
else.
guys? We'll just take one more. The
5 lenses.
5 lenses is on the previous slides. I recommend it's on one of the slides.
Yeah,
At
and the
the start.
recording you can have a look through.
You get in the recording. One more question, guys, we'll take.
Okay, so just read up on Monjaro, how it's a replacement to Ozempic, look at the pros and cons, that kind of stuff. Read up on it generally and understand what like treatments, why it's used, issues surrounding it, social media issues, that kind of stuff. They'll give you an article generally about it. Read the article specifically because that's what they're going to use in the exam as well.
Okay.
Mufti, when does the feedback from the MMIs come
As
out?
soon as possible. Like we'll try within 24 hours. That's pretty much as quick as we can do, but hopefully that should be good enough. What's a good percentage score in an interview? If you're talking about the Medentors interview, a good percentage score, anything above average, because a lot of our applicants are really top band scorers. So anything above average would be good. For an interview, what's a good percentage score? Some universities are stricter than others, so be different. How do you access recording? The recording is if you go on the community description, there's a Google Drive link, and that links to all the recordings. What I might do is I might just upload all of them on YouTube. So when I get time, I'll do that. It might make it a bit easier for you guys. But for now, there's a Google Drive in the link. So I do that.
Someone asked about the calculation stations.
Yeah.
Honestly, they don't ask more than GCSE math. Don't stress it. If you've done your UCAT, you'll be fine. Like there's not really much to do. If you really want to go over it, one of the common ones is drug calculations. That's like a really common thing that comes up. Honestly, it's not hard. Like it's just GCSE maths. Also somebody asked about what do you wish we did differently when preparing for interviews? Mufti, do you want to go first?
It's a really good question. So when I did interviews was a long time ago, and I think I've mentioned the story like so many times. But the first ever interview I did, my biggest mistake, okay, buddy. My biggest mistake I made was the fact that I was over prepared and I did too much research and my answers were very robotic. I wasn't as natural of a speaker as I am now. I wasn't as confident and I would just read off whatever came into my head. So the minute they gave me a question that I hadn't prepared for, I started recycling answers and jumbling them together. And that came across as poor communication. So what I'd really do and go back in time is to ask them for time to think, really hone in on my answer, link it, and do more practice. I was too focused on theory. And as a result, for the first interview I did, this was at Leicester Uni, I ended up getting rejected. And the reason for that was because my answer was too over-rehearsed. Now, thankfully, what I did is I asked them for feedback. And when they told me that that was my key mistake, I knew that this is one thing I need to work on. And as a result, what I did is I fix up this issue, I spend more time practicing actually answering questions, developing on the 5 lenses, talking about the biopsychosocial model. And as a result, all my other universities I got offers from, because I identified my mistake, which is why I'd recommend you guys to get feedback from as many people as possible. Ask universities for feedback, be yourself, and essentially just do as much prep as possible, really. That's all you can say.
For me, it's the opposite end, which was not balancing A levels enough during interviews. It's such a common issue, which is that just make sure you start earlier. Because A levels are you can't revise for them like in like 2 months. You have to do it like start earlier. So yeah, that's my thing. Mufti mentioned before as well. Just make sure you start earlier and balance it.
Yeah,
Mufti,
don't
someone asked about specific MMI tutoring for
um
each uni.
we unfortunately don't do that at Medentors. We did as part of our course, but that's essentially like gone. So you can't sign up now, unfortunately. However, if you do join our mock MMI circuit, that is specific for all universities that do MMIs for medicine and for dentistry. So I definitely recommend signing up for that. It'll give you the best overview of all the different topics. The majority of our students have said that, oh, this literally came up in our interview. And I'm like, oh, okay, fair enough. A lot of people have told us that our questions have come up. So that's one thing I'd say as well. But I think it's a really good session we've had today. We've nearly hit the 2 hour mark here. So thank you guys so much for being part of this webinar. I really hope you guys found this useful. Anything else in the chat as of the lesson, just tag us, ask us a question, and we'll try to get back to you. What I recommend you guys to do is watch over the recording, practice these questions again, even if you already practiced, with friends, with family. Time yourself for 2.5 minutes, record it, and really get that prep in. And I'm sure you guys will smash your interviews. Also, please keep me in your prayers. I've got exams on Thursday. So,
And
and
me,
Abdullah as
please.
well. And Loki, we're actually a bit cooked. We're probably more
Yeah,
cooked than you guys are for interviews. So,
yeah.
keep us there as well. And yeah, there's someone
No,
to
the
interview. So,
the actual exams.
yeah, I mean, okay, goodbye, guys. We're going to finish the recording.